Doğumdan sonra 1 yaşına kadar çocukların yaşadığı sağlık sorunları, rutin kontroller ve alınması gereken önlemleri sizler için araştırdık. For You Kliniği'nde görevli Çocuk Doktoru Georgieva haftanın 5 günü hastalarını ağırlıyor efendim. Siz de arayıp randevunuzu alabilirsiniz. İzliyoruz.
Nice to meet you. My name is Dr. Georgieva. I'm a pediatrician in For You. As a pediatrician, I look after the children from birth to 18 years. My work in For You include examination, investigation, treatment in children time, in childhood. Today I would like to explain and inform parents about a very important part of a child's life, that is first year after birth. From birth to the end of the first year, child's body have a lot of changes, development of all of the organs and system in the body. For this reason, we have to follow the child in this age. We have to follow physical and mental development of the child. During our regular checks, we can follow development of the child, and if we find some problems, we can solve these problems. For this reason, regular checks during the first year are very, very important. What I would like to explain parents, during the first year, we have some serious problems, not some serious illness, but problems which can give stress for parents and for child. First important that reflux for babies, infants reflux. That is a disease which is typical for first 6 months of life because of the not enough maturate gastrointestinal system, and the muscle who is closing stomach is still not enough strong. For this reason, children can have vomiting after every feeding. Usually they can have problems with feeding, with arching, and they cry a lot because of the pain. They can have poor growing, and for this reason, in this situation, we can help the child. Sometimes we can use medication like omeprazole if the condition is very strong. In the middle case, when a child growing is good but they have vomiting and we suspect reflux, usually the treatment is with anti-reflux milk, Gaviscon, which can make the food to be more thick and avoid vomiting. Usually after 6 months, because of the development of the child and make this muscle to be stronger, problem is gone. Next important problem in this age is suspected in cow milk allergy or intolerance to cow milk. Typical symptoms are serious colic, pain in the abdomen, vomiting, sometimes poor feeding, sometimes skin problems like dry and red skin like eczema. Just because of the symptoms, we can suspect and we can start treatment with hypoallergenic milk, which is proper treatment. Another critical problem in this age, typical for children, for babies, infants, that is bronchiolitis. Bronchiolitis, that is the inflammation of the airway. Reason for this usually are viral infection, and symptoms are critical with difficult breathing, with coughing. If condition of the child is very serious, with change of the color and condition is bad, the child has to be sent in the hospital for oxygen treatment, for nebulization. Very rare we have to use antibiotic, very rare, because if that is viral infection, treatment with antibiotic is not recommended. But sometimes we have to use. If the problem continue and the cough and condition of the child get worse, we have to prescribe antibiotics. Another problem in this age, typical for this age, is gastroenteritis. Gastroenteritis, that's mean inflammation of the gastrointestinal system because of the infection, viral, bacterial, parasites in this age, or some problems in the diet, which mean in this age, usually in the end of the 5th, 6th month, we start to introduce solid food. If we have some mistake when you start introduce solid food, that can give problems with like diarrhea, like tummy pain. And in this situation, we just have to be careful with the food. We have to make kind of diet. If the reason for gastroenteritis is typical for this age, rotaviral infection, treatment is with rehydration. Rotaviral infection is reason for gastroenteritis, who is typical for small babies. For this reason, here in England, usually babies have vaccination for that, which protect the body from this kind of viral infection. Another, which is very important, we have to know in the beginning, first year, is very important to know that we have to give vitamin D. Vitamin D baby can receive only with bottle milk, for example, because in the bottle milk they add vitamin D. If the baby is on the breast milk, usually we have to add like drops, like liquid, we have to add vitamin D for the body. And we have to make decision how much drops we have to give and to receive enough vitamin D, because that is important for the bones and growing of the child. After 6 months, another problem we can start, that deficiency of iron, because during the pregnancy, baby's body store iron from the mother's body, but after 6 months this iron is finished, and after that, if the feeding is not very good, iron have to be added like multivitamins if the child need, of course. Last but not like last step, last important problem in this age, that is teething problems. Teething problems teething is a normal part of development of the child, but during the teething usually baby can have sometimes temperature, some discomfort like diarrhea, can have sometimes sore throat, ear pain. In this situation we have to be sure what we can do. If the problem is just little bit, we can avoid some strong medication, but if the teething problem gives some serious problem in the body, we have to make decision about any other stronger treatment. What I recommend for parents who are very upset, they are worried about the small child, if they have some problem, if they are worried about that, they can come here. I'm here, and with my almost 30 years experience like a pediatrician, I can give advice, I can help them, and to feel more comfortable and happy with their child, with their infant, just to look how their infant is growing, and they're happy.